So today, this session has actually got two parts to it, and I'm just going to read the topics that we have, and then I'll get into the bios for the speakers. So the first topic is targeted rural health education, students making the most of a rural experience, and Stacy Kusler and Kay Miller Temple will be presenting that. The second part of this is health professions, education, and rural communities, community Apgar. And Dr. David Schmitz and Stacy Kusler will be presenting that. Let me go ahead and give you the bios for each of the presenters that we have. So for Stacy Kusler, as a workforce specialist, Stacy is the connection between rural healthcare facilities in North Dakota and qualified health professional job seekers. She assists rural facilities to attract medical providers and other health professionals to their communities by sharing job opportunities. She promotes the various loan repayment programs available to health professionals in the state of North Dakota and manages the state's J-1 visa waiver program. Through her position, Stacy is working to reduce the healthcare workforce shortages throughout the state. Kay Miller Temple is a health and medical web content writer at the Center for Rural Health at the University of North Dakota School of Medicine and Health Sciences in Grand Forks. She writes content for Models and Innovations, a web-based site that spotlights programs across the country that have found solutions to rural health disparities. Additionally, she writes feature stories for the online magazine Rural Monitor and serves as a writing mentor for several other projects and programs within the medical school. She earned her MD from the University of South Dakota School of Medicine, originally boarded in internal medicine and pediatrics and working as a primary care provider. She spent the majority of her first 15 years practicing in rural areas. In 2001, she joined Mayo Clinic Arizona and served as a staff hospitalist. She was part of Arizona's pilot team that created an inpatient palliative care consultation service and provided care for patients in a local inpatient hospice unit. In 2013, she obtained a master's degree in journalism and mass communication from Arizona State University's Walter Cronkite School of Journalism and Mass Communication. Kay was a 2019 National Rural Health Association and Rural Health Fellow and is currently serving on the board of directors for AgriSafe Network, a nonprofit organization focused on the health and safety of farmers and ranchers. Dr. David Schmitz is a professor and chair of the Department of Family and Community Medicine at the University of North Dakota School of Medicine and Health Sciences. He has extensive research experience in training and retraining of physicians in rural and underserved areas and development of rural communities' healthcare resources. He continues to practice clinically. He is a past president of the National Rural Health Association. All the presenters have indicated that their presentations will not include discussions of any commercial products or services and will not include any discussion of off-label and/or investigational uses of any product or services and will not include trade names. So with that, I'll turn it over to Stacy and Kay to kick off their presentation. Thank you, ladies.
There we go. Good morning, everybody. We'll just get our slide shared here. And sorry if you're just seeing the slide with the thumbnails on the left. We've been testing it and that's the best we can do. So, so thanks, Mark, for the introduction. And I'm excited to be talking about this project today with Kay Miller Temple. This project is so special to both of us, and we're excited to have you here with us today to learn more about it. Okay, so since you can't really see us too well, these are the photos of both of us. So on the top, that's me, and then there's Kay Miller Temple there at the bottom. And we've been working together on this project for a few years now, and it's just been so much fun, and it's been more fun every year that we've done it. So a quick overview of the objectives. Is during the presentation, we'll cover what the project is, why it's important for our student participants, what partnerships have been key to making this happen, and why communities should take note of the potential impact of this project using rural newspaper partnerships. So what is TRHE? The Targeted Rural Health Education Project is a writing project that students can participate in during or after a rural training experience. Aside from UND medical students who are part of Rural Opportunities in Medical Education, or ROAM, this project is elective and done totally by choice. Any student who shadows, completes a clinical rotation or clerkship, or even just has a special connection or interest to a rural community can embark on the TRHE project. Students select a topic from a recent community health needs assessment. They research the topic and talk with local providers about how and why it's an issue in that rural community. And then they write a plain language article, about 500 to 800 words in length, that will be pitched and hopefully published to the local newspaper. In a few slides, Kay will go through the writing process and what skills the students learn from it. The wonderful people you see on the screen are Camille Sherman, Dr. Camille Sherman, Dr. Dave Schmitz, and Dr. Brian DeLage, all from the UND Department of Family and Community Medicine. And this is really where the TRHE project was born. The department has continued to support and advocate for the program. And in 2019, this department enabled the TRHE project to be a required part of ROAM, which again stands for Rural Opportunities in Medical Education. ROAM is a 6-month rural immersion program for medical students in their 3rd year, and students are assigned to one of 6 rural sites and learn part of their 3rd year curriculum in a rural setting. And TRHE is now a requirement for those participating in ROAM, as it helps develop their connection to the community and to the community health issues the patients are experiencing. So how it started and how it's going, sorry if that's a little small on your screen. The TRHE project is still relatively new, with our first ever article being completed in 2017. Before TRHE was a requirement of ROAM, we would roughly have about 3 to 4 students a year take on the project. And since 2019, we now have over 10 students per year completing the project. In total, we've had 21 students complete the TRHE project. 5 articles are just in the process of being completed, and then 5 more will start in June. So all student articles are hosted on the North Dakota Rural Health Association website, which is available to the public to view. All completed TRHE articles were published in a rural newspaper. The only one actually that did not get published was an article written about COVID-19. It was written in June of 2020, which is fairly early on in the pandemic. And by the time the newspaper reviewed it and had space to publish, some of the stats were outdated. So of the articles completed, we've had student articles published in 3 states so far. And the communities on the screen in red are ROAM sites. The other communities are not part of ROAM, but students completed rural experiences in these communities. And it's important to note that we value our rural newspaper partners and their role in publishing these student articles. And as a way to show our support and to have better access to the stories when they do run, we have purchased online subscriptions to 5 of the rural newspapers. So now I will turn it over to Kay Miller-Temple to talk about how this project fits into medical education.
Okay. So again, my name is Kay Miller-Temple, and I'm a primary care provider boarded in internal medicine, pediatrics, and hospice and palliative care. In 2013, I did soul searching and went back to school and got a master's degree in journalism and mass communication. Let me tell you why we believe that TRHE is important for medical students as well as for all students in any healthcare profession. First, it introduces them to the concept of health literacy, especially the use of plain language. Medical students often have to prove their academic excellence with very complex words and very long sentences, but that does not work for patients. In all of my years practicing medicine, and as a healthcare writer and journalist, I have never had anyone say to me, "Oh, what you've explained is simply too straightforward. Can you repeat it using more complicated words and phrases?" So using plain language is a very important part of this project. And another aspect of TRHE is that we have the students dip into public health data. Traditional medical school residency training does not always emphasize the use of public health and population health data or a public health population health approach. They teach more about the medical problem in the N of one in that patient that's sitting in front of them. So in order to give the students the experience of looking through public health data, we send the students to the North Dakota Health Department website to find prevalence and incident rates of diseases, or we'll send them to the county health rankings and the CDC where they can find county level data, learning what their rural community looks like compared to other North Dakota communities, comparing that to surrounding states and often the country is very helpful for the students. Third, we viewed the TRHE as a leadership experience for these students. We had envisioned that the medical student would connect with the local newspaper editor, but that was a little bit of a leap, and we realized it was not realistic for our students. They are too busy and don't have the experience with that dynamic of connecting. So we pivoted, and their leadership is experienced more with what we say in their byline. Last, we are so pleased that for the Rome students, and the Rome program was just described by Stacy, TRHE is now an official mandatory part of the curriculum, and nothing validates a project more so than becoming a mandated part of the curriculum. Next slide. So before TRHE was officially endorsed as part of the Rome curriculum, Stacy and I recognized that we had to get student feedback on this project, kind of along those lines of, nothing for us without us. We couldn't possibly think we were doing something worthwhile for the students without getting their feedback. So Stacy created a Qualtrics survey. Here are 3 representative questions and responses, which endorses that the project is pretty well accepted by the students. And I know semester by semester, the Rome students are sharing with other students the positives and the negatives of the program. And I think it's really well accepted. Next slide. I do believe then, because that is so well accepted by the students, that if we even waited until the students were in their 4th year, we actually might get even more positive responses, especially after residency interviews, because we've heard some anecdotal stories from our students who are interviewing for residency slots that when those stories show up in the publication section of their CV, it has gotten attention of those who are interviewing them. When you are one of hundreds of applicants, something unique like a publication in a rural newspaper can make you stand out, and that's helpful for our students. Next. So we have got, those are our current newspaper partners. Next slide. So our rural newspaper partners, I think some of you might be surprised by the results of this particular survey. And I had interviewed the director of the Nebraska Newspaper Association back in 2017 for a story that I had done on health literacy. And what he said resonated. Rural newspapers are read, reread, clipped, saved, taken to clubs, card games, and left in all kinds of settings. It is a natural medium for rural America, and we want our students to recognize the value of getting their health education pieces into the rural newspapers where the community members can appreciate them. Next slide. As I mentioned several slides ago, we've tied the leadership aspect of the project to their byline. We want the students to envision that their newspaper story serves as a community resource and allows them to disseminate their expertise well outside the boundaries of a clinic room or a hospital room. Next slide. We do recognize that one of the unknowns on our side of the project is the relationships between the community healthcare organization and the local newspapers. We don't include that in our scope of our TRHE project, but I wanted to bring this slide to our audience because there are some valuable things that you all can do that kind of further capitalizes on the strength of rural newspapers. If you're a healthcare organization, you can partner with your rural newspaper and think about providing a special edition of the a newspaper where you can work with the local newspaper and you provide the topics, the experts to be interviewed, the budget for advertising. They put it all together. And the key is to mail it as a bulk mailing to everybody in the service area. So anybody with a mailing address gets it. That allows even those without a newspaper subscription to see this information. Next slide.
So why should you care? Why care about a student writing project that is so far limited to just a few communities in the state? Teaching students to write in plain language helps them communicate to patients in plain language. So we believe that this project is making our students better equipped for the future. And additionally, if your students have if you have students training at your facility from UND, you can encourage them to complete the TRHE project. You can play a role by helping them connect to your community health needs assessment, connect with people to interview for their story, and be their go-to for questions about the community health needs in your area. And just because your community is not on the list yet doesn't mean it won't be. So what's next for TRHE? We would love to expand the project to be more inclusive of health profession students outside of just the medical doctor class. It's open to all health profession students at UND currently, but MDs are the students who have taken the most interest so far, again, with the help from Family and Community Medicine Department. We've also taken steps to create a toolkit about the project so we can inform other states about the project and assist them with getting started. So we believe in this project and in connecting students to rural communities on a deeper level. And we also know the importance of great communication from healthcare professionals. And this project teaches things they maybe didn't realize they needed to know.
And again, remember, if there's questions, feel free to enter them in the chat session.
Well, thank you, Mark. And I want to give a special thank you to both Kay and to Stacy for making the Targeted Rural Health Education Project what it is in North Dakota. And it's really been a powerful learning tool for our learners. And I hope that we continue to see it expand. I'm also going to apologize we have been testing our technology, but I know that we will have probably the PowerPoint as I adjust it here in please excuse that while I get that adjusted to the best of the ability to make the image large. And then I will say in advance that I actually know also that the computer will as I end the slideshow and begin the questions. So please, if you do have questions about this particular presentation on the health professions education in rural communities, Community Apgar, or on the Targeted Rural Health Education Project, do enter those into the chat and we will respond to those while my computer resets and then I can finally stop the screen share. So again, I'm Dr. David Schmitz. I'm a family physician. I have learned from being a physician in a town of just over 2,000 that sometimes you're asked to write an article in the newspaper, and that's actually where the TRHE project came from. I was 29 years old and showed up for the first year of rural practice, fresh out of residency, and was asked to write an article on colorectal cancer screening, colonoscopy, and had never done anything like that before. And so I thought this would be a great project, but I can say that it's work with the community of communities, rural communities, and also with the Center for Rural Health at UND, which has been really part of the joy of being here as department chair for 5 years. And the Community Apgar project is a big part of that. And so I'm really happy that Stacy can join me. I'm going to go ahead and go through some slides relatively fast, just to be able to orient those of you who have participated in Community Apgar projects here in North Dakota already, or those of you who may be invited to participate now or participating in the future, because it's really a series of projects. And Stacy, as being that interface between the Center for Rural Health and workforce, you're just such an excellent partner, along with the others at the State Office of Rural Health and really the Center for Rural Health, that allows us to extend education, as well as building workforce and better healthcare for our rural communities. So that's the actual goal of today, is to orient you to the Community Apgar set of projects, as well as this one in particular, which is new. Well, I need to acknowledge my research partner back in Idaho, Dr. Ed Baker at Boise State University. We've been working together for over 10 years, and in this particular case, also acknowledge the Montana State Office of Rural Health and AHEC. You're probably familiar with Area Health Education Centers, and Montana AHEC has actually sponsored this new tool development known as the HPERC. We called it that because I'm also a fan of these shortened titles, and coffee, and the health professions education in rural communities was a mouthful. So HPERC is what we're going to call it. And the original Community Apgar program, as you'll hear a little bit about, was developed in Idaho with the help of Mary Sheridan in the State Office of Rural Health there. Interestingly, we've seen significant utilization of Community Apgar programs across the United States and even internationally. So I'll give you a little bit of that history, because I think it can be helpful for especially those of you who are in rural communities who may be involved in the Community Apgar project, to kind of have some background around what it involves. It's actually not a gigantic time commitment, but for a small time commitment, it may be helpful for you to understand how doing a 1-hour survey can really contribute to not only knowing your own community, but also being able to sort of raise all boats for communities trying to achieve a certain goal within the state. So I'll review some of that and the nature of how the Community Apgar questionnaire and projects work, and then we'll talk a little bit about the future and hopefully have time for questions. We really started this because of a need, and it was originally when I was in the state of Idaho, again about 10 years ago. I had been continuously trying to recruit physicians to our small town of 2,300. We had a critical access hospital with part-time access to surgery. We were delivering babies at the time, and we certainly needed to find ways in which we could improve our local efforts around physician recruitment, and it was really a need statewide. And so we wanted to kind of put together our practical knowledge and use our community engaged research, is what we would call it now, but to use those and leverage those relationships with those who knew, to be able to cooperatively see what we could do with regard to physician research recruitment. And so we actually enrolled and worked with 3RNet, Rural Recruitment and Retention Network. You may be familiar with. Stacy, again, can help provide more information around that, as well as the National Organization of State Offices of Rural Health was really key to being able to expand this across the country. And then eventually some interest from the University of Melbourne as well. Virginia Apgar in 1952, as an anesthesiologist, developed a rapid way to assess the health of a newborn. So you could look at these various aspects of a newborn very rapidly and be able to assign a score between 0 and 10, which allowed the team to instantly communicate what was going on, whether or not you could have mom up, the baby up with mom and enjoy those moments, or whether there was really a critical need to have an intervention, whether that be with regard to the heart rate or the breathing, etc. And so we wanted to try to be able to have a rapid assessment that would do the same thing for communities with regard to rural communities having a particular function. And so it turned out that this was something relatively new in the research field. I was brand new to doing research. I was a new teaching faculty, and my now 15-year-old daughter is pictured with me there in my younger days. But we found out that if we were able to take some qualitative information, that is to perform a 1-hour interview with a couple of people in a rural community, we might be able to get some quantifiable data and then be able to give some graphs and charts that could be points of the discussion around strengths and weaknesses in trying to accomplish things as a team, and trying to be able to have a better approach with regard to closing gaps and also emphasizing and capitalizing on strengths within a community. And so it started again with physician recruitment, specifically in critical access hospitals. This was back in 2007. We subsequently went on to do this looking at nursing recruitment, so recruitment of RNs to critical access hospitals. And then subsequently looked at recruitment of physicians in community health centers because we felt like that was a little bit different and needed some different variables, some different questions asked. And subsequently, we went on to expand this actually across the country in a number of different states, as you can see, between 2011 and 17. And I had the fantastic opportunity of traveling to those states, actually going to those rural communities and being able to conduct interviews with people in the state to be able to really understand what's going on in Wisconsin versus Iowa versus North Dakota. And that was actually when I spent the majority of my time in North Dakota prior to coming to UND. And then subsequently, we actually have had interest internationally. We had a expansion of the tool used to recruit nurses in rural Australia. And that was a fantastic experience to see how that was different in Australia than in the United States. And right now, Australia is rolling out a tool looking at recruitment of pharmacists in rural Australia. So that's going to be fun to see if we can bring that back to the United States. But in the meantime, we've got in development, looking at recruitment of hospital CEOs to critical access hospitals. We hope to bring that to North Dakota here in the future. But today we're going to specifically talk about health professions education in rural communities. So as you can see, the community Apgar is really just a template. It's a way of doing community engaged research, but it's not just research, right? It's service. And what I would like to explain is that whether or not you are a community health center, a rural health clinic, a critical access hospital, or whether we're looking in this case at health professions education, the goal is to bring confidential information to your individual community. We don't share your information with any other community, but that you can have a comparative analysis to what's going on in the state. So the question is, you might have, let's say you want to be a more engaged in health professions education because you believe that it increases quality of care. You believe that it actually allows learners to have the kind of experience in your community that makes them want to come back to your community as workforce and be part of your community. And it also is just better for education, in my case, medical education. If you wanted to do that, wouldn't it be nice and convenient to have a report or a chart or have a discussion facilitated saying, okay, here's the important factors. How do I actually know which ones I might have a lower score than what's going on in the state, and which are my strengths? Which ones in the state are challenges all over the state, or maybe all over the country, or which ones are unique to my situation, and how could we solve them or actually mitigate some of the challenges? That's what Community Apgar does. It's sort of a differential diagnosis in that case. And so the first point in getting the tool to work right is to validate it, is actually to take a look at, for example, what are the factors that help a rural community be a great place for education. So whether you're educating a nurse, whether you're educating a medical student, or maybe a resident physician, because we do have family physician residents who go out on rural rotation, for example, how can we have the right resources or look up or meet some of the common challenges around being the best rural education campus, if I can use that word, that we can be? And that's sort of my day job these days, you know, as a department chair in family medicine and with regard to rural opportunities in medical education, our ROAM program, we have students all over North Dakota. And we need to thank you for being the excellent educational resources you are. We're a community-based medical school, and we couldn't do that without you. So I did, for a couple of years, have a dream. Is there a way that we could actually bring resources to make all of our educational experiences, both on the community side and the student learner side, the best they can be? And so that's really the long-term goal of this project, just one community at a time. So when we look at the factors that are most involved with regard to an excellent experience for a rural community educational experience, we started with the scientific literature. We did a literature review. We looked at what's known and published, what the evidence is. We also brought in expert opinions, and then we collaborate with you. We learn from the communities because North Dakota might be different than Maine or different than New Mexico and different than Montana even. So in this case, that's what we do, is we actually refine the tool to try to move forward. So the structure of the questionnaire, which is what functions during an interview, is actually that there are 50 factors, and each of those factors is in placed into groups of 10 within 5 different categories. And you can see them there. This is how it's represented. And then we ask 3 open-ended questions to see whether or not we missed a factor. We don't want to miss the most important factor that makes a place a great place to learn and a place you want to come back to. So that's why we ask and make sure we didn't miss it. So here's an example. You can see at the top we have categories such as geographic or scope of practice or educational support. And these are some of the factors that you can see here listed. And I'm going to just give you a couple examples of each. So one of the factors we look at is a geographic factor. So for example, proximity to the home campus. North Dakota is a big place. So is Montana, where we've actually launched this project already. And so the question is, how far is the location of your rural community from, for example, their home campus? And why does that matter? Are they traveling back for a required exam that has to be in person? Are there other things that are related to that? What about having family and friends in a community or being from that community? What about the opportunity for their husband, wife, significant other to be able to be part of a rotation, especially like with Rome, for example, where it's actually a 6-month placement? We look at health systems and community support. We look at the support of the local facility leadership. Those of you who are community leaders, who are CEOs of your hospital, have such a critically important role with regard to supporting the placement and the environment and the experience of our learners, such as our students, that obviously we want to take a look at that as one of the factors. What about your website and brand recognition? You know, we looked at that for physician recruitment. What does a student see when they come to your website? Those sorts of things. And when we looked at scope of practice, in this case, it's really the practice as it applies to the learner learning, right? And so we wanted to look at things such as the diversity of patient population. We wanted to see whether or not there was interdisciplinary team taking place or the use of telehealth. It's interesting to see if students are either have the option of being on call at night or weekends, maybe to get that experience in the emergency room or even deliver a baby, or is it required? You know, so these are some of the interesting things that may affect the behavior of students and the sites. Around educational support, this is sort of my home base with regard to being a faculty and department chair, are we providing the right kind of faculty development? Do we have the policies in place that make it easy to place a student there? What about mentoring or some of the other points that may actually develop relationships? And here, as I finish in a couple of minutes, I just want to ask if Stacy's got any comments with regard to her experience, both working with this project and also physician recruitment.
So the biggest thing I want to mention is that I've been talking about the connection between having students training at facilities with recruitment and retention of these students. And there are so many factors in each of the classes Dr. Schmitz just went over that point to that or can involve that. So things from having a welcoming patient, having welcoming staff, making sure that they get the warm fuzzies when they're in that community. All of those things point to giving them a feel of what it would be like if they were actually to take a job there, live there, raise a family there, whatever it might be. And so I just think so many of these factors point to setting your program up to benefit in that way, that I'm just really excited to go forward with this and hopefully have some great conversations with our communities about it and learn what they're already doing or spark some ideas on what they could be doing.
Thank you, Stacy. And I'll ask you to come in the end too, as we talk about rolling this out in North Dakota. But of course, student housing is something that we continue to work on. And if any of you who are working with our students, unless they're able to commute that short distance to their housing, obviously housing continues to be something that we see as a very important issue of support and collaboration, no matter where you are in the country and in rural medical education. So again, it's really just a tool for you to confidentially, within the project, assess your assets, capabilities, and perhaps ways to be able to see how things might be able to be creatively solved even on a state level, if not just within your individual community, or how to get around problems or adapt to issues that just simply can't be changed. We hope that this is allowing communities to be able to assess their strengths, maybe even post those on the website or share those with your community members with regard to some of the strong attributes and great partners our communities are in both educating and recruiting workforce. And so we believe that it's an opportunity to prioritize your plans, to inform your board, to look at how you want to derive resources to make in this case, your rural community the best education campus it can be. And we hope that it's beyond just expert opinion, because you're the expert, and the collective expertise of those who are able to, again, in confidence, be able to supply information, tell us much more about what's going on in North Dakota than just trying to be the expert without that engagement. And so we believe that this will continue to be helpful to communities, in this case, with regard to health professions education, and it's specifically in rural communities. But there'll be ongoing use of community Apgar. We hope, again, both within the United States, even internationally, to look at how communities and rural communities can work together to be able to address needs such as workforce needs, as well as these educational opportunities being maximized. So right now we've deployed the health professions or HPERC across rural communities in Montana. We're validating the instrument to make sure it's measuring what we believe that it should. And then subsequently, we're already engaging to be able to do this across North Dakota. I'm very happy to have Stacy be the person to operationalize that. As Stacy, you've got really good experience with regard to using the physician recruitment Apgar as well. And then what we'd like to do is actually look at what worked, what have we learned from the project, and I'd actually even like to have a Project Deco, for example, if you're familiar with Project Deco, of rural communities that would like to work together, and learn from the information that we've gotten collectively and make our UND campus of rural communities even better. That would be the ultimate objective, I guess, from my perspective. So here's our contact information. I'm going to go ahead and try to stop sharing my screen, but I know that that's going to probably be a little bit of a challenge, and my computer will have to reset before I can do that. So please excuse that. We've practiced this and tried, but there is our contact information. Please feel free to contact myself or Stacy in particular. We are happy to have any questions while my computer reloads and I can stop sharing my screen. Stacy, would you like to make any comments? Looks like we have about 5 minutes, or if there's anything in the chat.
I don't see anything in the chat. The only thing I just want to mention is our communities in North Dakota are so wonderful that when we're rolling out a new project like this, it took one email and I had 6 communities come back with a, yep, we'll do it. So in that way, it's just really appreciated and makes me all the more excited to be working on this project with our wonderful North Dakota communities. So for those of you who haven't been contacted or aren't part of the project this time around, don't worry. It's we're kind of doing this as a test round, so there's only 10 communities total that we're going to be doing in this part of the study, and we'll be doing this again next year too. So we'll roll out any communication if there's opportunity for more communities to get involved. And if not, as you saw with the previous community Apgar project, we did get a lot of leverage out of that project by sharing just the general factors and what that might mean for your community. And so even if you're not taking part, it's hopefully you'll be able to benefit from the information that we gather from this.
That's really true, Stacy. In fact, again, I'm ambitious to say, but I think we will be able to have a Project Echo community share some of the findings of the HPERC community Apgar, so that even if you didn't participate in the initial gathering of the data, we will be able to show anonymous cumulative scores across these parameters, which will allow us to identify what are the toughest problems that we should try to address. What are some of the things that are really great about North Dakota, really makes what UND what it is, which is one of the best rural mission community-based medical schools in the country, is how I feel about it. And it's because of our rural communities, our hospitals, our clinics, and our teaching preceptors. So I want to say thank you. and hopefully we can offer a community to anyone who'd like to be involved through the ECHO project over the next year or so as well.
So thank you so much, Stacy, Kay, and David, for your excellent presentation. I don't see any questions out there now, but we would like to ask the attendees to make sure they fill out the post test survey so that we get that information. Thank you, and hope you enjoy the rest of your conference.
Thank you.